an antibody treatment that you can take monthly that will block some of those inflammatory proteins. This came out in New England Journal of Medicine. We were involved in this study, and now they're trying to expand the study to more broadly, and we may join in some research on this drug. It's called crizanlizumab. You can ask for it 7-Eleven. So anyway, but that's one potential treatment, but it's that anti-inflammatory approach to try to decrease inflammation, not make the cells not sickle, not make the fetal hemoglobin, but actually address the blood vessels and make the blood vessels less abnormal, and hopefully improve blood flow and oxygen to the tissues, and people be healthier.
That's Maya from Instagram. We're going to get into that, Maya. She's talking about the 60 minutes.
Yeah, we're going to get into that.
Yeah.
Are you supposed to take penicillin when you have had a spleen taken out?
Yeah, the recommendation is that you continue taking penicillin when you've had your spleen taken out.
Really?
That is the recommendation. I must say that not all my patients who've had their spleen taken out continue penicillin. As far as penicillin use in every other patient with sickle cell who's lost splenic function, which happens in most SS patients, and actually most sickle cell patients will lose their ability of the spleen to do its function. They take penicillin up through age 5 or 6, and then after that it doesn't appear to be much additional protection. The recommendations were that people who have surgically removed spleens, they stay on penicillin to prevent these pneumococcal infections, things like that. Those recommendations may change, but right now that is the recommendation, to stay on it.
And so, as he's saying that, did you have a question?
That's the same thing. They're talking about the 60 minutes. We're going to get into that in a minute.
Yeah, we want to talk about the 60 minutes right now. Actually,
I think that's such a big news, and it's something that
So how do you feel about that?
My patients. I've been talking to my patients for a long time about this. Mm-hmm. The first case of a successful gene therapy that was reported for sickle cell came out 2 years ago in New England Journal of Medicine. Reported a young kid from Congo in France who got treated with the bone marrow. With the gene therapy.
France one. I heard that one.
But that was sort of what I'll tell you what they do. But I'll just say the idea that you can change the patient's own cells to produce a healthy, non-sickling hemoglobin is a great change, and it is not going to be cheap. It's not necessarily going to be like everyone can get it, but it is potentially a way that you could cure anyone with sickle cell. The idea is that you take out the person's, you collect the person's stem cells, and when we do bone marrow transplants for cancer or things like that, we'll give patients a medicine to stimulate their stem cells to go in circulation. Then we draw them off from a catheter, and then we do several collections until we have enough to do the job. So we want to get these stem cells so that we can, when you give those back, it replaces the bone marrow in people who've had chemotherapy. Well, in sickle cell anemia, for the gene therapy study, for gene therapy, what they do is they collect these stem cells, and they want to continue to collect cells until they get the necessary amount, several million cells probably. You get these cells, and inside the lab, by using this viral vector, it's not a living virus, but it's like a viral protein that can get into and introduce the cell, introduce this gene into the cell right in the area that you want to modify the hemoglobin so it doesn't sickle anymore. It's kind of complicated, but it's done inside a lab, and you have a way of marking which cells actually have the right gene in the right place. You can actually check that. So they'll collect these cells that have been modified. When they have enough of them, they'll give them back to the patient and let those cells replace.
I have a question. I think it's Maya.
If it does, then that replaces their cells, and they start making their own cells, but now with a modified, healthy hemoglobin that doesn't sickle.
She says, "Are you familiar with a treatment drug called Sickle Cell?
Not by that name. What does it do?
Explain what, do you know, can you explain to Dr. Harrington what it does, Maya?
The connection. That's the only thing I have to do it again.
Here's one out.
Yeah.
All right, we're still on Instagram.
Okay. I'm going to go back in, okay?
Can you explain that drug? Because he says he doesn't know about it. Or maybe, am I saying it incorrectly? Sicklos? Yes, I think that's what it was.
So tell us a little bit, as she's coming up, tell us a little bit what you thought about what he's doing, his research, Dr. Harrington.
Anyway, what do I think of the research? I think it's very, very exciting. Dr. Tisdale is the one they had on the show, and he's a well-known sickle cell researcher at NIH, National Institutes of Health, and he has been working in gene therapy, actually, gene therapy, but also just genetics in sickle cell for years, and they carried out some of these studies, but the initial work in France was done with a different group. And there's actually different potential targets for gene therapy. But what they did is they put in a small fragment of the hemoglobin into these patients' genes that stopped it from sickling. It still does the job of carrying oxygen, picking up carbon dioxide, and doing its normal function, but when it gives up its oxygen, it doesn't sickle like a sickle cell protein does. Sickle cell protein, when it gives up its oxygen, it takes on a shape and forms these long chains. This doesn't do that.